Paul, it's a constant piece of work for you to raise the agenda, to raise the issue of mental health on the agenda. Do you feel people are waking up to the size of the issue and getting more comfortable about talking about mental health issues?
Yeah, I think we're beginning to see the signs of a real shift in terms of attitudes towards mental health. We know that the general public are beginning to change their attitudes around this issue, and we're starting to see that reflected in workplaces. I think also we're beginning to see organisations getting to grips with what they need to do to be able to tackle both the way in which they support managers, the way in which they support staff who disclose mental health problems, but perhaps more interestingly, or as interestingly, we're seeing people thinking about the well-being of the whole of their workforce.
And you hinted that actually, of course, a lot of managers sometimes find this quite difficult, perhaps at all levels, to raise questions of mental health. How can they be helped to get it on the table in a safe and non-threatening way?
But it's really important to equip managers with the ability to be able to ask those questions. If you see a member of staff who maybe isn't quite the way that you're used to them behaving, or maybe their performance has dipped just a little bit, equipping them with the ability to have that conversation is really important. That's about good quality training for line managers, particularly for new line managers, but also good quality supervision and support of the line managers themselves.
Now, I'm sure Mind doesn't want to become a kind of language policeman, and of course journalists are the guiltiest of using language carelessly. But what can we do about this talk of people claiming to be schizophrenic and the use of medical terms to describe non-medical conditions? Is there anything we can do about using language more carefully?
Well, we think that we don't want to be the language police, and so we recognise that people will use certain phrases in the way that they feel comfortable. But we also know that if you get the language wrong, it can be very damaging to the quality of people's mental health. And we saw that a couple of weeks ago with the Asda and Tesco story, and also the headline in The Sun, where people were coming back to us and telling us how difficult they found that. So we want to encourage sensible phraseology, sensible reporting in the media, and use of the words where it makes sense. I mean, there's nothing wrong necessarily with using the word mad. In fact, mad is being reclaimed by mad people. So that's good. But I think it's often when people talk about schizophrenics or manic depressive. So these are people first, and people who are experiencing a mental health problem feels like the best way to talk about it.